Hello, this is Gary Owen, President and founder of Medicare Journey, a national 501c3 nonprofit organization dedicated to providing assistance with unbiased information, education, and transparency in Medicare insurance planning. So, will there be mayhem in the Medicare world in 2025? That's the $64 million question that I have proposed. My friends, there are major changes coming to both Medicare Advantage and Medicare prescription drug plans for 2025. In this video segment, I want to focus specifically on prescription drug plans. The next AEP, or annual enrollment period, from October 15 through December 7th, 2024 could be the most disruptive since the introduction of Part D nearly 20 years ago. So two regulations, the IRA Inflation Reduction Act and CMS final rule for 2025 plan year will impact almost everyone who's on Medicare. Now, I'm not a messenger of gloom and doom. However, I do believe it's imperative that every single person who is on Medicare or soon to be on Medicare be advised of these issues and plan accordingly. So if you are on a Part D drug plan or a Medicare Advantage plan, you will most definitely be impacted with these upcoming changes and will need to have an analysis or a review completed during this coming AEP. In August 2022, the IRA, or the Inflation Reduction Act, was signed into law. Of course, there are many components of the IRA, but what does it mean to you specifically as a Medicare beneficiary, or if you're turning 65 and soon on Medicare, where there are some important changes, particularly with Part D or prescription drug plans. One of those changes covers drug price negotiations. The law allows CMS, which is the Centers for Medicare and Medicaid Services, to negotiate directly with drug manufacturers to lower, finally, the prices of some of the most expensive brand name Medicare Part D and Part D drugs. These negotiations have been underway and will take full effect in 2026. The top 10 negotiated pricing for prescriptions in 2026 include Eliquis and Xarelto blood thinners, Juvia, Jardiance, Farxiga, Novolog for diabetes, Imbruvica for leukemia, Stelara for Crohn's disease, Anestro for heart failure, and Enbrel for arthritis. So from 2027 through 2029, the federal government will be negotiating prices on 50 additional high-cost drugs. Also, beginning in 2025, people with Medicare Part D will not pay more than $2,000 for their annual out-of-pocket drug cost. So this will drastically lower the maximum from $8,000 and eliminate the coverage gap, which we know as the donut hole, and the catastrophic coverage phases. Is that great news? Well, maybe. The government is now holding pharmaceutical companies accountable and providing relief to millions of Americans who can barely afford their prescriptions. Additional changes include limiting monthly cost sharing for most insulins to $35. Drug companies are now required to pay rebates to Medicare if prices rise faster than inflation for drugs used by Medicare beneficiaries, and expanded eligibility for full benefits under Medicare Part D, LIS, or Low Income Subsidy Program. But I believe the Inflation Reduction Act will have unintended consequences for seniors. It seems to me that if the drug manufacturers are going to be limited on the cost of drugs that they can charge a Medicare consumer, they're going to find a way to make it up. And how would they do that? Well, could be higher premiums and possibly reduced formulary choices. We believe that there will be a significant reduction of drug formularies. We're limiting the number of plans offered to Medicare beneficiaries. And due to the annual out-of-pocket maximum being lowered to only $2,000, it's almost certain that we will see higher utilization of drugs, meaning higher costs for the drug companies. You can certainly envision the unpredictability that we are going to be dealing with in 2025 with Part D plans and MAPD plans, which we will address in our next upcoming video segment. A recent survey was distributed to a research panel of over 160 healthcare decision makers, including healthcare executives, medical, and pharmacy directors. That survey found that 34% expected a limited financial impact, and another 44% predicted the IRA to have an adverse financial impact on prescription drug plans. Listen, we know to most people that this simply sounds like Medicare mumbo jumbo. And it is. It's confusing. It's complicated and ever changing. That's why it's crucial and more important than ever that you work with an independent insurance agent who can be your dedicated and unbiased guide, who specializes in Medicare insurance planning. Not only is it important that you choose the right Medicare insurance plan with the right carrier, but just as important is choosing the right Medicare insurance agent or agency. You should consider working with an independent insurance agent who is a member of MedicareJourney.org and who can be your dedicated guide. These agents are vetted and experienced professionals who will always have your best interest at heart. As always, if you have questions or need additional information, you can contact our Medicare Journey helpline at 833-267-6700 or visit our website at www.medicarejourney.org. And be safe out there, everybody.